afternoon, or good evening rather, and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for both their acute and chronic medical needs via our telemedicine program, concierge medicine, primary care, COVID-19 vaccinations, as well as COVID-19 testing, through my Amazon best-selling book Vitality, as well as through our segment on CBS 42 News every Monday morning at 6:30 a.m. called House Calls. Good afternoon, ladies and gentlemen. We're joining you today to chat a little bit about the update from the CDC concerning the mask guidance. So, in case you haven't heard or seen in the news, just a few hours ago, the CDC reversed their decision in regards to masking, or let me just say adjusted, let me say it that way, adjusted their mask guidance for persons that are vaccinated if you are in areas that they have a high transmission rate. And what this means, and that would definitely include our state, the state of Alabama, as unfortunately we are last in terms of percentages of our community that are vaccinated, to the tune of about 33%. So what they're saying at this point is that people who are vaccinated, they're recommending, if you're in a high transmission area, which would be the entire state of Alabama, that when you're indoors, if you're vaccinated, they're recommending that you mask. I'm going to talk a little bit in a minute and explain a little bit some of their findings and why they're suggesting that. This was something, we did a Facebook Live, I want to say, last week or maybe the week before. I know for at least the last couple of weeks since we've known and seen the increase in the Delta strain throughout the community, we have been recommending that our patients go ahead and start remasking, knowing that there are higher amounts of the virus in the environment. So one of the reasons that we recommended that is because you have to think about it this way. If you know, hey, I'm vaccinated, so I'm protected, right? And decreased risk of me getting a COVID infection. However, if you are in a community where 2/3 of the people around you are not vaccinated, which means they're actually a reservoir for this particular strain of COVID-19, the Delta variant, unvaccinated individuals in our state have been a reservoir for this. And when I say reservoir, that means that it's going to circulate easier among that population versus a population that is actually vaccinated. So, knowing that, that means that more people will likely have the infection, which means that when you go out places, and we have to remember, we talked about before how viruses are passed, right? Viruses are passed when we cough, when we sneeze, when we blow our nose, viral antigen particles in the air. So if you're in an environment wherein there's more of that, that means that it's probably going to be easier for you to get it in that area versus being in a community where 70 to 80% of the community is vaccinated, right? That makes sense. So in that vein, if I'm in an environment where there's more of the virus in the environment, that means, and we know that COVID has been proven to be airborne, we know that there are more respiratory droplets circulating in the atmosphere, right? That means it's more likely, you're going to be more likely to get it in that environment than in an environment wherein there's not 67% of the community that can serve as a reservoir for the COVID-19 virus. So that's what that means in particular. So with the new guidance, they're just saying indoors for people that are vaccinated to wear their masks. Now, there are a lot of people that have shared with me, I never stop wearing my mask, Dr. Celeste, because it's, the pandemic isn't over, that kind of thing. I know that a lot of guidelines, a lot of people have become relaxed, and when they changed the guidance and said that people that are vaccinated didn't have to wear masks, a lot of people, whether they were vaccinated or not, stopped wearing it. And so think about this. This is one thing that I thought about. If you will remember last fall, winter season, every year we have a flu season, right? So every year there are thousands of people that get the flu. We have a flu vaccine. We've had it for years. We've been, giving a vaccine to help prevent the flu spread in our community, right? But guess what happened last year? We had a big push for people to get vaccinated against the flu because we didn't want people dealing with COVID and the flu at the same time. Too big of an issue to be fighting two viral respiratory illnesses at the same time that could succumb to death, right? But what happened is the number of cases of flu virus, and I see Preston's on the line. So Preston, who's an RN, can attest to that. We worked many a season together during a flu season where you see, just seeing 100 people a day, you see a lot of people with the flu. This year, we didn't have a harrowing flu season as typical, right? Why? Because we wore masks. So the place where you're most contagious or get respiratory droplets, respiratory antigen exists here in your nose, right? Expelled out into the environment. You had a mask that prevented that. So this is much like the same thing, and I do realize and know that a lot of people have issue with the mask wearing. I know that at this point, it's about the love of humanity, and what everyone does is tied one to the other, right? So we've all got to get on the same page and decide, hey, you know what? We're all going to do what's best for the community as a whole, which would include masking, making sure that we're, socially distant, we're washing our hands, doing all the things that we know that we can do to decrease the risk of spread of this variant throughout our community. Because if you didn't know, it's surging. Okay, it is surging. I know that there are at least 20. The last count that I got. And I'm sure it could be more at this point. The last count I got from 4 days ago was 24 children that are intubated at Children's Hospital. There are 20-year-olds that are in the ICU or being faced with being intubated that are begging to get a vaccine now. But unfortunately, it's too late. It takes about 4 weeks for you to develop immunity to COVID-19. So once you get the vaccine, you still have to be careful, extra careful. You're still at risk those 4 weeks of having no protection. So this change with the mask, with them, suggesting that you wear masks as well, and let's give a shout out to the Birmingham City Schools for saying, hey, you know what? We're going to require all our students to wear a mask. What they're doing when they do that is they're protecting those students and their families, and by God's grace, they're protecting those teachers, because they're around, because although the teachers can be vaccinated, a lot of the kids cannot be vaccinated. So that in and of itself presents its own quandary of itself. So back to the mask guidance. So I know that a lot of people are, just done with the mask thing. People have COVID fatigue. I know that if you talk to any physician that is currently working, has been working in the last 2 years, they will tell you that they are perhaps fatigued. But at this point, we've got to do what's best for us as a community, and what it's going to take is us taking a unified approach, and everyone realizing that what I do makes a difference in what happens in the people next door, and the people down the street, and the people across town. Everyone that's in our community, because it is what it is at this point, and if we don't get on the same page, we're going to be facing an entirely different animal in terms of leaving time for these variants or these viruses to mutate into different variants or strains of COVID-19, which is what has happened with this Delta variant, right? But guys, guess what? There are other strains. And I know, and someone mentioned this to me yesterday that, no one else had mentioned or talked about, that there's another strain that's out there called the Lambda variant. It's not in Alabama, not that I know of, as of yet anyway, but it is in our country. So we've got to quickly and swiftly act to do the things that we know will protect our community. And the things that we know is wearing the mask, being socially distant, washing our hands, and that vaccine. It's really, and unfortunately, it is just as simple as that. So if you're someone that's out there and says, you know what, Dr. Celeste, I'm not taking that vaccine, I'm not going to do it, they're playing with people's DNA. It's not playing with anyone's DNA. That is a lie and a myth and an incorrect one. It's going to make me grow an arm out of my chest or something. I've just heard all kinds of weird things. It isn't going to do that. Compare the millions of people have received these vaccines, and the number of people that have had side effects from the vaccine is very small in comparison. If you compare the percentage of individuals that have succumbed to death, number one, as a result of COVID-19, we know in the first year over 500,000 Americans died as a result of this virus. we're heading into really what is a third year, because it came around in 2019. It didn't hit here in 2019, but it started then, right? So we're heading into a third year, right, of dealing with COVID. If we do not act swiftly, and at this point, we as the citizens of this state of Alabama have to act swiftly to protect our state. And we have concern, any health professional will tell you that they have grave concerns over it. You're talking about side effects from a vaccine compared to what you succumb to and what we've seen happens in hundreds of people that are positive with COVID-19 in terms of being intubated. There are a lot of people that do not get off of the ventilator. They die. There are a lot of people that don't make it to the ventilator. They die. That is more likely to happen in someone that has not received a vaccine and is not fully vaccinated. Those are just the facts. That's not something that someone is twisting or making it be something that it's not. It's simply what it is. At this point, and you may be out there saying, okay, what can I do? If you're vaccinated, what can I do? What you can do if you're vaccinated, wear a mask, except when you're in your home. Continue to be very careful about the things that you expose yourself to. If you are sick at all, if you're like, it's my allergies, it's that time of year, no. We need to make sure that it's your allergies and we're not passing COVID-19 to someone else. That is what time it is for. It's the time for, if you're sick, we need you to get tested to make sure. You can get a COVID test anywhere. We do COVID testing. Urgent care centers do COVID testing. Vestavia Children's Urgent Care, American Family Care, Dr. Celeste does COVID testing, UAB does COVID testing. Get it wherever you're going to get it, but make sure that you get it so that you don't infect someone else, right? Because this is the gift that's keeping on giving. Well, we're tired of it giving. We need it to stop giving, and we need to do what we can to help protect our community. So that's the first thing. The second thing is encouraging someone or sharing a story with them. I know that I have a personal story that I share with a lot of people all the time about a family member of mine that succumbed to COVID-19. And while I won't share that story here at this moment, what I will share with you is that it was a death that was preventable. One of the things that occurred in this particular situation is that this family member of mine did not get appropriate care in a timely fashion. They don't live here with me in the city of Birmingham, but they could just call Celeste and say, hey, this is what's going on. Can you call me? Can you, get me in with someone, that kind of thing. So they had to rely on the care that they received. And the care that they received, unfortunately, was not the best care. So he ended up succumbing to COVID-19. If you're listening, and let's say you have that story, please share that story. Share that story with other people. Allow them to share with other people. Because a lot of times, it's the affiliation with other people and actually that makes it real for people for them to understand that this is something that is not, and if you see, guys, we are a year later. I've been talking to you guys from, on Facebook Live, in a phone, still talking about the same virus a year later. And we have things that will help, but it's getting muted out by things that have nothing to do with humanity and dignity and respect for one another. And that is what is going to need to be brought to the forefront for us to get over it. We're going to have to work together. It's as simple as that. It doesn't matter where you stand politically, doesn't matter where you stand religious-wise, doesn't matter where you stand on any side of this. If we don't work together to control this, this is not going to end up in the most favorable way that it can. And I think that we can do a lot as individuals to help that. It takes one person to share one story one time for some people to get it and say, hey, you know what? I think I'll go ahead and get the vaccine. Or I think I'll go ahead and wear that mask. Or I think I'll make sure that I go and check to make sure I'm not sick before I'm around my grandmother. Or make sure I'm not sick before I'm around my mom. Or make sure I'm not sick before I'm around my kids. Take the necessary steps. And I know that it's challenging. And I know everybody's tired of being inside and cooped up. Guys, I'm right there with you. I am tired of being inside and cooped up and not really enjoying life to the point that we've known it to be. But at this point, we are at a pivotal point in this journey. And if we do not take action swiftly, then we are not sure where we will be a month from now even. Because a month ago, we weren't where we are right now. And I see that Preston said UAB is packed out again as well. So Guys, it's just as simple as that. They changed and some people are like, okay, why do I have to wear a mask? Let me hit this really quick. Why do I have to wear a mask if I'm vaccinated? I thought the vaccine was supposed to protect me, so now you're telling me to get this vaccine, but I'm still going to have to wear a mask anyway, right? The guidance is that you wear the mask if you're in an area with high transmission. Ding, 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 the state of Alabama. Not what we want to be known for. We want to be known for football records, not this, okay? So let's do something about that. In a high transmission area, there's more viral respiratory droplet things in the air, higher transmission rate, right? Well, the studies that the CDC director referred to when they made their announcement suggest that individuals who are having breakthrough infections of COVID-19, although they don't have severe symptoms at all, most of them do not have severe symptoms at all, like someone who would that is unvaccinated, they may have a higher viral, what we call a viral load, or viral antigen, you hear us use that word a lot, in their nose, right? So while it won't cause this person any issue, because I am vaccinated, I am, protected and against severe infection, intubation, death, etc., right? Largely decreased risk of any of those complications if you're vaccinated, right? They still may have a viral load in their nose, and there's concern that that viral load can infect someone else, especially if you're in a high transmission area. So what they're recommending is, let's cover it up to prevent the antigen from leaving your nose. It's really that simple. So it has to do with viral load, and I know that's a lot of scientific mumbo jumbo to some people, but essentially what that means is by them wearing that mask, they're already going to have a very mild course of illness if they're positive. And keep in mind that the few people that have had breakthrough infections, and if you look at the percentage of people that are vaccinated versus the percentage of people vaccinated having breakthrough infection versus vaccinated not having any, it pales in comparison. 90 percentile, right? So them wearing the mask is just going to help to protect and prevent that viral load from leaving them to potentially infect someone else. That is what the CDC director was referring to, and that is why, to help protect the people that they're around, if that makes sense. Okay? Does anyone have any questions? Anyone have any questions? Anyone have any questions? If you are out there and you're like, okay, well, I work in this kind of place. So let me just say this really quick for teachers. And my mom, bless her heart, she's on now, is a teacher, served Montgomery County for well over 30 years. Just phenomenal woman. And so I obviously have a soft spot for teachers. If I were a teacher, the things that I would make sure that I did, I would have my own little program for, and I'm sure the schools are going to sanitize your rooms anyway, but I would have my own little secondary set or program for sanitizing my room. I would have just, hand sanitizer, Lysol, all of that everywhere. Obviously, if a child gets sick, you want to send them away right away. The one thing I do want to share with you about masks is, so now that we're back, wearing masks, and for those of us that never stop, make sure that if your mask is dirty, okay? So we're in a high transmission area. So respiratory drops, just think of it this way, and this is what I told my patients today. All my patients I talked to today, I told them this. Act like when you move about the cabin that everyone you see has COVID-19. If you do that, then you'll protect yourself. Because if you think everyone has COVID, you're not going to shake their hand, you're not going to be hugging up on them, you're not going to be just up in their face, you're not going to do all of that, right? You're going to make sure you clean your hands with hand sanitizer, and really, you're going to make sure that you stay away, right? So you have to treat it in that way. But what I would do as a teacher, I would make sure I had a clean mask every day. Let's just say that you're out somewhere, and let's just say that you sneeze or your mask gets wet. This one is big. If your mask gets wet, throw it away. Go ahead and make the plane have extra masks. Everybody listening, please put extra masks in your car. Put them in your car. Put them in your car. If your mask gets wet, throw it away. And unless it's one of the masks that are reusable or you wash them. If you are an immunocompromised person, diabetes, high blood pressure, heart disease, asthma, COPD, kidney disease, sarcoidosis, any kind of autoimmune, any of that. If you have any of that, when you leave your home, there are KN95 masks that are at gas stations that offer you a little bit more protection than the surgical mask. I love the surgical mask for everyone. I love the KN95 mask if you're going into areas that are high transmission areas. Ding, 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 Walmart, pharmacy, Publix, anywhere where you know that there are going to be people that are sick may go there and they may not know that they're sick or they may know that they are, but they need food, all kinds of different situations. But when you're going in those areas, you want just a little bit of extra protection. And again, we're going to make sure it fits very snugly across the bridge of our nose. We're going to make sure it completely covers our mouth and is stuck to our face, not stuck to your face, but firmly on your face. Not loosey-goosey, not coming down, not any of that. I will tell you, especially if there's anyone listening that's a patient of mine, you guys know how I am. We never took the signs down requiring you to mask anytime that you enter our office. That definitely is a requirement for someone to have an appointment for primary care. We are testing them prior to them coming in the office. Why? Because we can't have a closed, or at least I can't, have a closed-door conversation with someone unless I'm sure that they're negative. And it doesn't matter if you're vaccinated or not. We test to make sure, because I'm sitting in there for 20 to 30 minutes to talk to a patient, right? And, that's just protecting us and the staff, etc., and allowing us to continue to service the community. Second thing with teachers, I would make sure I have plenty of hand soap, plenty of paper towels. I would make sure that even after you do the cleaning, make sure that you wash your hands, right? Make sure that you wash your hands. Let's see. She said, do you suggest children be vaccinated? Ms. Robinson, I do suggest children that are 12 years and older be vaccinated, yes. They do not have the younger age pediatric vaccine now. I'm told that will be out this fall, but I am recommending that children get vaccinated. 24 kids are in children's on a ventilator due to COVID, and that's just in the city of Birmingham. 24 kids, right? Right? You guys remember polio? Or ever heard of polio? Some of you that are younger, like Pretty Barbie, she's young, I think. Never heard of polio, probably, right? Do you know why? Because we invented a vaccine, we didn't invent a vaccine, but physicians did years ago, invented a vaccine that prevented it and killed it in our community. Polio paralyzed several people years ago, and they came up with a vaccine to eradicate it, right? Similar to what's going on now with COVID-19. Unfortunately, a large part of what's going on with it has been muted by interests that have nothing to do with humanity and make it harder to help people. Let's see. Vaccine for my kids, Doc. Yes, for Kinley, not yet. I mean, once it comes out, I would, and I definitely will give you my opinion about the vaccine when it comes out. But yes, I'm recommending, and this is why. We vaccinated our girls. I have bonus babies with my husband, and Maddie and Morgan are 14 and 17, and we have vaccinated them. Maddie is a cheerleader, and so, she's a cheerleader. So she, football games, all of that, and even though they're outside, she still needs protection. She's going to be around other little people, and little people have their own little sequester of germs, right? But little people also are not as OCD as we are as parents, right? To be more cognizant of the surrounding. Although the girls do a great job, because Miss Celeste is their stepmom, so they're constantly watching me and me constantly showing them things. So they actually do pretty good. But in general, little kids aren't necessarily good with that, right? So that just offers another layer of protection. I know that the last thing someone wants to do, and it's a tough decision for parents, but the last thing someone wants to do is end up with an infection, or their child end up with an infection, or them seeing their child, have to be intubated. I mean, just breaks my heart, and breaks my heart for those parents, and especially for the kids that are there now. We pray for their total healing in Jesus' name. Let's see. Ms. Robinson said, I'm an educator and we'll be double masking every day. Yes, Ms. Robinson. I hope you have a KN95, and I don't see one right now, or I would show you one. I will post one. I made a post once with a black mask that's a KN95, but they have them on Amazon. If I were a teacher, And what I want you to, because that one gives you more protection, but isn't so bad. Isn't so bad in terms of tightness, but it's something that you can, if you can learn to live in that mask, I think that you'll feel better, and you will definitely be better protected. Double masking, because we have yet to see safety as the top priority. I know, Miss Robinson. I'm so sorry. Teachers stock up on your sanitation products now. Sanitize after each set of students, precisely. And if you're able to have the windows up in the classroom, if they allow that, or if they will do that, because another big part of it is ventilation. And see if they'll even let you have like a fan. I know that the gym that I go to is a small, not small in size gym, but a smaller gym in that it's not like a Gold's gym or a Lifetime. And one of the things that my trainer does or has done is have these huge fans that are in there. That's circulating the air so that droplets aren't just sitting around ready to fly into your nose. So if they allow you to have a fan in the room, I would ask. I definitely would ask. Okay, parents, be sure your parents have hand sanitizer and wipes every day, and you send them to school with that. Thank you. That is a great piece of advice, sending the kids with their own sanitizer and wipes. She said she has it for her kids at home. Okay. Anyone have any other questions? We were on CBS a little while ago, and we're talking about the change in the mandate. And one of the questions they asked me was what I would say to someone that was unvaccinated that was having an issue. Because I talked to some people today that said, Dr. Celeste, you cool and all, but I'm not getting that shot, right? And I was like, and I always ask permission, hey, can I talk to you about it? I don't like force my will on people. Not trying to, but I am very intense about it because of what I've seen, what I've experienced, and what I hope we can prevent other families from experiencing, and other people, making decisions like, you know what I mean? Like my spouse has been on a ventilator for 8 months. Do I turn the ventilator? These are the kinds of conversations. So what I would say to a vaccinated person is, have the conversation now with your husband, wife, or significant other to find out if you're on a ventilator, how long you want to be on it, or what your status is as far as, DNR, which is called do not resuscitate. Those are the conversations. And I know that may sound harsh. I hope it doesn't come across harsh because I don't mean it to, but I'm being so direct and honest with you that is a conversation that you need to have, because I've witnessed it. Families having to make that decision and going through that, and it is extremely painful. Seeing your child have an infection and they can't breathe, and having to watch them be on a ventilator. These are the kinds of things, guys, that we have to kind of talk about. If you don't wear a mask, you can't expect your children to do it, right? Because they're going to do what mommy and daddy do. So if you want them to wear a mask and protect you guys while they're at school, which is what they'll be doing because they're at school, then you should do that as well. She said she can't hear me. She can't hear me. She said, how are the children going to be able to... Let me just take this off. So hopefully you can hear me. Let me know if you can hear me now. Someone give me a thumbs up. If you can hear me. I would ask them if you can have a fan. If you can't have a window, just see if they'll allow you to have a fan in there. Can you hear me? Can you hear me now? Can you hear me now? I don't know why you can't hear me, but okay. I'm not sure why you guys can't hear me. Can you hear me now? Can you hear me now? I don't know what to say, guys. I'm not sorry. I don't know why you can't hear me. Um,
Okay, I don't know why you can't hear me. You can hear me now? Preston said yes. Okay, you can hear me now. Okay, great, great, great. Thank you, Preston. Thank you, Miss Robinson. Thank you, Pretty Barbie. Appreciate it. Okay, so how are children going to be able to be safe and protected if they're not old enough to get the vaccine and new viruses out? Great question. Children can be protected if most of us are vaccinated, right? It leaves less of a reservoir or a petri dish, so to speak, for the vaccine to hang around and circulate and mutate, right? So the children masking every day is going to help protect that child's family and to protect the child. Essentially, the only protective measures we have for the children is what we had before we had a vaccine: mask, washing our hands, and being socially distant. And I'm sorry to say that at this point, that is the only protection that they have, other than their parents being vaccinated, so that we know there's decreased likelihood of this child getting the virus from their parent who has been around people at work and or etc., and less likelihood of that parent giving it to that child who's going to go to school and be around other kids that are from other families. So that's the only protective measure, other than, of course, prayer to our Lord and Savior. Okay, I hope that helps. Everyone's back in. Okay. All right. So sorry about that, guys. I don't know what happened with the AirPods. They're probably getting old. I probably talked on this phone. Yes, Miss Robinson, we as adults must do what's necessary to protect these babies, and that is exactly what is the truth. Um, so that's really all I had to share with you guys today. I do think that I have a personal belief that I feel like God is going to cure us from COVID when we learn to work together. That's the spiritual side of what Dr. Celeste thinks. In reality, we're going to have to work unified, right? At least the state of Alabama, to get over this. Because what I do is tied to what you do, is tied to what they do, it's tied to what I do. So my behavior will influence you. The behavior of someone else will influence you. So if enough of us don't get on the same page, I'm not sure where we will end up. And that's part of the reason why I feel like God is behind it, because it's just, one of those things that He wants us to all love each other. He wants us to care about one another. He wants us to look out for one another. He wants us to make sacrifices for one another. And this is one of those things where even though you're like, hey, you know what, I don't feel like it. And I get it, you work out, you do what's right, you take the steps necessary to help protect yourself, but it's going to take all of us doing it together before we will be over this. And if we don't see anything else, guys, if you're out there listening from the state, if we don't see anything else from seeing that and what's happening, our state is last. We win football titles, national titles for football in this state. We won several during my 47 years of being on the earth. Lots of them, and definitely, more during the Nick Saban era, right? So let's let people remember us for that, and not as Alabama has the lowest vaccination rate, because what that it's just not a good look. It's just not a good look. And I think that we can do better. And I think that God expects us to do better. And I think that we're going to have to do better to get out of this. And so I hope that everybody, will get on board. That's right. Together we stand. Divided we fall, period. And that's true. It's so, so true. So, and it's just, my blessing is tied to your blessing. It's tied to someone else's blessing. It's tied to someone else. And, I think that He expects everybody to do their part. I definitely am trying to do my part. I'm trying to do my part. I'm trying to do my part. Um, I hope that everyone will get on the same page and put humanity first. That's what I hope, and that's my prayer. So, does anyone have any other questions? I could ramble on about COVID-19 all day. A lot of you guys know that. as we're just trying to keep everybody safe and help protect our great state of Alabama. So I'm encouraged, and I have enough hope to believe that that can happen. Because people change, things change, situations change, and there's nothing more important than the human life in this saga, and that's what's important. So that's all. Thank you all so very much for listening to me ramble on. I hope I said something that was helpful. If you're not vaccinated, and let's just say you're like, hey, you know what? I have a question. People come in and get vaccines at our office all the time, and they want to ask a question first. They ask it. Sometimes they come in asking questions. They get the vaccine. Sometimes they don't. We don't hold people down and make them get the vaccine. I don't believe in that. Um, but if you have questions and need them answered, talk to a trusted medical professional, no matter who that is, whether it's me, whether it's Hernando Carter, whether it's Amy Bentley, whether it's Jamie Bell, whether it's Cree Johnson, whether it's Mia Cowan, whether it's Dr. Novalaw, whether it's Dr. Agee, whether it's Dr. Gardner, whether, you know what I mean, whether it's whoever it is, please talk to that person. Please get your questions answered. Please have a clear understanding of why and what's going on. In the last 3 weeks, the number of cases of COVID in our state has gone up by 400%. Today alone, I talked to at least 3 times the number of positive people we had 2 or 3 weeks ago. 3 times the number, right? And these are the rapid tests that are coming back positive, not even the standard PCR, which is much more specific, right? So just, talk to someone. So that's all, guys. I'm not going to ramble on. We will hop on, as things pop up and as we have information, be able to share with you. Again, we provide COVID testing, COVID vaccinations, and primary care. And one last thing, if you're out there and you have not had blood work, okay, this is important. If you've not had blood work and seen your doctor in the last year, if you live in a whether you live in a high transmission area or not, I encourage you to go see your doctor, get your regular blood work done if you haven't had it done. One of the things, especially if you're African American, you need to know if you're deficient in vitamin D. If you're deficient in vitamin D, it is vital that you replace it, especially if you live in the state of Alabama and you're African American. We're more at risk for having complications of COVID, and especially if you're not vaccinated, you need to replace that vitamin D. It helps your immune system to fight, and there's been a correlation between vitamin D deficiency and positive COVID cases. So that's all I had to share. Hope you guys have a great day or a great rest of your evening. You can reach us at 205-291-8842 if you're in need of COVID testing or vaccinations. And that's all I had to share. I hope everyone has a great day. Hey, Auntie Jean. That's my Auntie Jean. Hey, how are you? I hope that you guys, I hope that was helpful. If you know someone that's not vaccinated, please talk with them. And if they don't do it for themselves, ask them to do it for you or for the community, especially if you're their mom or grandmother or grandfather or uncle or something of that nature, father or what have you. Ask them to do it for you. If they don't do it for themselves and won't do it for you, ask them to do it for their kids because they're protecting their kids. You are. And if you don't, you're not. And it's really that simple. It's just really that simple. But, as the weeks go on, I hope that we'll see an increase in the number of vaccinations. But you'll just pay attention and watch, find a source. The Alabama Department of Health has their numbers on their site all the time. You can follow those to see the cases and how they're trending in our community. So that's all, guys. Have a good night. Bye-bye.